Okay, there's an 81-year-old female here for mainly right arm pain. She was at a chiropractor. That chiropractor 3 weeks ago kind of bear hugged her while trying to adjust her spine, and 10 minutes after, she had pretty severe pain in the right upper arm, kind of towards the surgical neck of the humerus, right in this region. Let me have you slip out here too.
Sure.
So we're going to go ahead and do an ultrasound. She has really no active flexion and abduction. Her x-ray of the humerus, negative for fracture. And the shoulder joint looks pretty good. So worried about a rotator cuff tear. Here we're going to go over this very large rotator cuff tear. You can see complete supraspinatus tear, full thickness infraspinatus tear of the very anterior fibers, partial subscap tear, and here we can see this distended subscapular recess, which essentially overhangs the cephalad border of the subscapularis tendon. Here we're showing this distended subdeltoid bursa, which most likely communicates with the joint, given the fact that she has a complete supraspinatus tear, as there's no tendon intervening between the walls of the bursa and the underlying capsule, and again, there could be communication between those two structures. Here we're going to look at the biceps tendon in short axis, basically our home base view. You can appreciate a moderate effusion around the biceps tendon. Then above it, she has this large fluid collection. Initially, thought it was a subdeltoid bursa, but upon further view, this seems to be really just a distended subscapular recess. Now we're going to look at the biceps tendon in a long axis. You can see that biceps tendon essentially just right above the shaft of the proximal humerus. And again, you can appreciate this very large fluid collection above the biceps tendon, consistent with this distended subscap recess. Here we're going to actually look at the subscapularis tendon in long axis. Looks like there's a partial bursal-sided tear. And then here again, you can see this overhanging subscapular recess. And now we're going to look at the subscapularis tendon in short axis. You can appreciate the biceps tendon. And then if you go caudal to that, you'll see the subscapularis tendon, which looks pretty irregular, consistent with at least some intrasubstance and some bursal-sided tearing as well. Now we're looking at the supraspinatus tendon in long axis. This is the most impressive finding, as there's a complete tear. You can see a cartilage interface sign. There's no supraspinatus tendon. Essentially, this is just joint fluid we're looking at, and this is consistent with a complete supraspinatus tear, which is consistent with her MRI findings. Now we're going to go ahead and look at the infraspinatus tendon in long axis. She may have an intrasubstance tear, as there's some dark anechoic signal, but essentially the thickness of the tendon is pretty well preserved. It was read as a full thickness tear of the very anterior fibers. And here you could see some dark signal of that cephalad portion of the infraspinatus, consistent with this full thickness tear, although there may be some anisotropy involved. Here's our AC joint. She got some mild to maybe moderate capsular hypertrophy, but not very impressive overall. Thank you.